Hi, this is the public health assignment for culture assessment of future chiropractic practice. My name is Judith Masiminali. All right, let's get started. I wanted to start off with saying that I'm originally from Rwanda, and the capital city is Kigali, which is where I am from. I would love to go back and practice over there, as this has been my goal since I, started chiropractic school, which is a big reason as to why I started chiropractic school. The demographics of Rwanda are that the population in Kigali is about 1.1 million. This makes the city very overpopulated. Rwanda in general is about the size of Maryland, and the population is over 12 million. The age structure is the majority of people are between the age of 25 to 54. The sex ratio is 1:1. The nationality is Rwandan, and the majority religion is Roman Catholic. The official languages of Rwanda are Kinyarwanda, French, and English. However, Swahili is spoken as well. Personally, I speak English and Kinyarwanda. In terms of being an outsider versus an insider, I consider myself a little bit of both, because as a person who grew up there and was born and raised there, I am considered an insider. However, I also consider myself an outsider because I have not lived there for about almost 11 years, and therefore I feel like integrating myself into the community as a completely different person as I was 11 years ago would be a bit of a change. However, I also do have a lot of my family living there, so that makes me a bit more of an insider than an outsider. In terms of public health needs, to find out any information that you may need, you can visit the the Ministry of Health website, which I've put right there. Currently, their focuses are sexual reproductive health, education among teens, improvements in maternal health, malaria prevention, and mental health awareness. These are all integrated in various parts of the communities, be it hospitals, schools, and so forth. Currently, there is only one chiropractor in the whole country, as far as I know. She practices in the same city that I do. She has been there for 3 years right now, and practices within a hospital. She does not own her own practice. I'd like to go back there and be one of 2 chiropractors, hopefully more. However, I do intend on having my own private clinic once I'm working there. My personal market niche is pregnant women and pediatrics, because currently in the health center, that's the majority of the people that I'm seeing, which is children and some pregnant women. As far as practice plan, I intend to do my research when it comes to demographics, as well as so this is pretty much the same research I have done, and see how I can meet their needs according to those according to that information. I plan to also implement cultural competence staff training, and this could be anything to teaching my staff how to, welcome everyone, be it of a different sexual orientation, different race, gender, as well as religion, and teach them on the importance of being sensitive to the different kinds of people that could walk into our practice. Community-based services. I'd love to be able to implement health classes, and these could be a great way to teach the community about first and foremost, what chiropractic is, what it's about, but also teach them how, through chiropractic, they can better their lives, and many ways in which they can be positively affected by chiropractic. I also intend to do a little bit of community development myself. One of the things that I would really love to do with my practice is have satellite practices within the country. This could be either a physical clinic, or it could be centers in which I set up, various days during the month, and go to maybe more rural areas where people may not necessarily be able to afford my services, and give them free care. This is a picture of the city, and I thank you for listening to my presentation.